Welcome to this explainer. Today, we're jumping right into a major breaking story that's been making waves over on Londoner.news regarding a humanitarian worker who was medically evacuated to a London hospital over Ebola concerns. Now, whenever we hear the word Ebola, it instantly grabs our attention, right? It sounds scary. But rather than panic, we're going to stick to the facts and look at exactly how the UK handles these kinds of high-stakes medical situations. By the time we wrap up, you'll see the incredible, highly structured safety nets that instantly click into gear when a high-consequence infectious disease knocks on the door.
Okay, so let's just address the elephant in the room. The question that's probably flashing across screens and dominating group chats right now. Do we actually have an active case of Ebola in the UK?
The short answer is absolutely not. The UK Health Security Agency, or UKHSA, has been super clear on this. They've stated explicitly that the individual is not displaying any symptoms and remains totally well. This medical evacuation from the Democratic Republic of the Congo was strictly a highly precautionary measure. Basically, they were treating patients with the disease abroad, so authorities just aren't taking any chances.
The logistics here are actually wild when you think about how meticulously it's being managed. This humanitarian worker was brought back on a flight chartered solely for this evacuation. We're talking no commercial flights, no public transit, nothing like that. Right now, they're completely well. But because the Ebola virus has this sneaky incubation period that can last anywhere from 2 to 21 days, they are being monitored in strict isolation by top-tier infectious disease specialists for that entire window, just in case.
So, before we go any further, let's take a collective deep breath. Because of these incredibly strict isolation measures, and the fact that there are 0 confirmed cases in the UK right now, authorities are stressing that the risk to the general public is exceptionally low.
Now, to really understand why this extreme evacuation was even necessary, we have to look at what this worker was actually facing on the ground. As of mid-July 2026, the Democratic Republic of the Congo has battled over 2,124 confirmed Ebola cases during this current outbreak. That is a massive, massive scale of infection in a very complex region.
And this isn't just your standard outbreak. The World Health Organization has actually declared this a public health emergency of international concern. There's active transmission in the DRC right now, with 828 deaths reported so far. You see, this specific outbreak is driven by the Bundibugyo virus. It's a really severe strain of Ebola that spreads through direct contact with infected bodily fluids. And what makes it so tricky to catch early is that its initial symptoms are kind of vague, things like fever, fatigue, muscle pain. Historically, this specific strain has carried a devastating fatality rate somewhere between 30 and 50%.
But what makes this outbreak particularly challenging and frankly heartbreaking is this number, 119. That is the number of health workers who have been infected in the DRC as of mid-July. It just completely underscores the immense, persistent occupational risks faced by humanitarians who are out there on the front lines trying to save lives.
With those immense risks in mind, our medical toolkit is, well, surprisingly limited for this specific strain. Right now, there are no approved specific treatments or licensed vaccines for the Bundibugyo virus. We are relying entirely on experimental candidates. Therapeutics are only just being evaluated in clinical trials, and even the most promising vaccines are still months away from even being ready for trials. So if a worker is exposed, strict isolation and supportive care are quite literally the first and best lines of defense. Which brings us back home. If treatments are experimental and the risks are that high, how exactly does the UK safely bring someone back without putting everyone else at risk?
The answer lies in this highly structured web of specialized centers spread all across the country. It's the NHS High Consequence Infectious Diseases Network, or HCID for short. Think of it like a giant safety net, designed to catch, isolate, and manage deadly pathogens instantly. No matter where an alert happens in the country, there is a controlled, expert response ready to roll out.
And within this national network, London plays a really critical role. The Royal Free Hospital, located right here in the capital, serves as a specialized adult airborne HCID center. They don't just scramble to get ready when an emergency hits, they are on permanent standby 24/7.
Treating a highly infectious pathogen definitely doesn't happen in a regular hospital bed. Instead, the NHS uses a jaw-dropping £25,000 state-of-the-art patient isolator. This thing is literally a sealed polythene tent running on negative air pressure, which that means is air can flow in, but it can't flow out without being heavily filtered, which stops any aerosolized particles from escaping. Even the waste isn't thrown in a regular bin. It goes into an autoclave where it's blasted with high-pressure steam at 121 degrees Celsius to completely destroy any trace of the pathogen.
Let's step inside one of these high-level isolation units for a second. Picture this. It's on the top floor, locked down with restricted electronic access, and it only houses 2 of these specialized beds. This setup allows an elite team of volunteer doctors and nurses to give comprehensive care without ever actually touching the patient directly. They work through these built-in sleeves and gloves attached right to the tent, keeping them totally shielded. There's even a separate bolted-on tent just for passing food and drinks, and the floors are color-coded to enforce strict contamination zones. It is an absolute masterpiece of infection prevention.
But this localized readiness feeds into a much bigger national system. Like, what if someone just walked into a local clinic with a travel history to an affected area? Well, the NHS triggers a strict 4-step emergency pathway. First, immediate isolation of the patient. Second, an urgent huddle with local infection specialists. Third, they contact the 24/7 imported fever service. And finally, they coordinate a highly controlled, safe transfer using very specific ambulance protocols.
Through all of this, terminology really matters. We constantly see headlines screaming about suspected cases. But in the medical world, a suspected case means an individual who has actually become unwell following possible exposure. Authorities only use this label if symptoms are present. And remember, our monitored worker in London has not developed any symptoms. They're being monitored, not treated as an active suspected case.
But let's say symptoms were to develop. The system moves lightning fast. Using advanced RT-PCR technology, they can confirm or rule out Ebola in just 4 hours. And within 7 to 8 hours, they can run a full viral panel to see if maybe it's just malaria or another regional illness. You aren't left waiting in limbo for days. The answers come fast, so the exact right protocols can be activated.
So looking at all of this, the specially chartered flights, the 25,000-pound isolation tents, the permanent standby networks, we have to ask the big question, why? Why does the UK invest so much time, money, and effort into these complex networks for a disease that isn't even native to the country?
Well, it matters because this level of meticulous preparation allows the UK to safely support the brave humanitarians risking their lives abroad, all while building an absolute fortress at home to protect the public. But as global travel increases and remote outbreaks reach our doorsteps faster than ever before, we're left wondering, is one nation's world-class readiness enough to fight tomorrow's global pandemics? It's definitely something to think about. Hey, to stay totally up to date on live developments regarding this specific case and for all your other vital local news, make sure you head over to londoner.news. Thanks so much for joining me on this explainer, and keep asking.